Hello everyone and welcome to my YouTube channel. I'm Kimia, and in this video I'm gonna read an article that I chose from ABC News website. It's a health and medical article, and as I read it I'm going to explain the phrases and the new vocabulary that you might come across in similar health articles. So let's get started. How blood donations are helping 3-year-old with rare disorder play like a normal kid. So basically, blood donation means giving your blood to someone who needs it. And in this case, there is this 3-year-old girl who has a rare disorder, and the blood donations, people who donate blood to her, is actually helping her play like a normal kid and live like a normal child. So this is the 3-year-old girl that we're talking about here. 3-year-old Lauren Zeller gets blood products 3 times a week at home. Pictured here with her mom, Claire. So let's read it from the first line. 3-year-old Lauren Zeller has a 1 in a million bleeding disorder, but she's able to run, jump, and tumble like other little girls. Tumble means fall suddenly or roll over, thanks to the kindness of strangers. Lauren was diagnosed just before her first birthday with a rare and severe form of von Willebrand's disease, type 2B, which impairs blood clotting. So von Willebrand's disease is actually a genetic bleeding disorder that makes it hard for the blood to clot. So the body cannot easily stop bleeding in this case. And when we say it impairs blood clotting, it means it makes the body's ability to stop bleeding weaker. So it's actually harder for the body to stop bleeding in most cases. Let's continue. As a baby, she bruised easily and ended up at the Queensland Children's Hospital emergency department when she started teething after the bleeding continued for hours. So blood clotting means the process of stopping bleeding by forming a clot, and bruise, when we say she bruised easily or she got bruises easily, bruise means a blue, purple, or dark mark that is caused by bleeding that happens under the skin. And when we say she ended up at the Queensland Children's Hospital, it means finally she had to go to this hospital to be taken care of. And when she started teething, it means when her first tooth began coming out. Okay, let's continue. This is a photo of Lauren Zeller, who was diagnosed with a bleeding disorder just before her first birthday. Okay. Every 6 to 8 weeks, the typical bumps of childhood turned into something more serious, requiring visits to the hospital for blood treatments. Bumps means small hits or knocks. So it's saying that every time that, for example, she would fall or there was a small knock or hit, it would actually turn into something really serious. So she had to visit the hospital. She had to go to the hospital regularly. Earlier this year, she had surgery to insert a Port A catheter into a vein in her chest. So when we say insert a Port A catheter into a vein, it means they had to place a special tube under the skin so it would give easy access to her vein for receiving treatment, allowing her parents Claire and Rob Zeller to give her blood product at home 3 times a week, reducing the need to take her to emergency. So that catheter enabled them to take care of her at home, and they didn't need to go to the emergency department all the time. The product known as Biostate contains 2 proteins essential for blood clotting. So the product that this girl received was named Biostate, and it had 2 essential important proteins for blood clotting. So that would actually help her blood to clot, and she wouldn't bleed that much after receiving this Biostate. human coagulation factor 8 and human von Willebrand's factor. These were the 2 proteins in the product. Okay, and coagulation is actually another word for blood clotting. It means the body's ability to stop bleeding. I don't really want to think about what would happen if we didn't have the blood products. This is actually said by Lauren's mom. They are life-saving for her. If you can't stop the bruising or the bleeding underneath there, then that would be quite disastrous for her. Disastrous means something that is so terrible. It causes disaster or serious problems. So when something is disastrous, it means it's very bad. 1 dose of the blood product contains proteins collected from the plasma of up to 50 donors. Despite Lauren's illness, the Zellers have worked hard to allow their daughter to run around like a normal kid, engaging in rough and tumble with her brothers Harry 6 and James, Harry 8 and James 6. So engaging in rough and tumble, it means playing actively, physically, like running, wrestling, falling, just like how normal kids play. Normal kids that are super active, how they play is actually described as rough and tumble. 3-year-old Lauren Zeller, who has been diagnosed with the bleeding disorder von Willebrand's disease type 2B, pictured with her mom, Claire, and dad, Rob, both doctors. So actually you cannot see the picture right now here. But being able to give her the blood product regularly at home has relieved their stress around their daughter having a fall. It means it has reduced their stress. They're not stressed about their daughter falling down anymore. They're not stressed as much as before. We were the helicopter parents standing ready to catch her as soon as she fell. But we can kind of take a step back now and let her have her freedom to explore. We can give her the freedom to become who she wants to be, running around, exploring the world. It means discovering, searching, without having to chase behind her, without having to follow her with hands ready to catch her, so she doesn't hurt herself and fall. So before, because she wasn't able to, her body wasn't able to actually stop bleeding, her parents worried about her all the time, and they would chase her in case she fell. They had to catch her as soon as possible and take care of her so nothing serious would happen after the severe bleeding. But after being able to receive the product and after her body was able to do blood clotting or coagulation, they weren't worried about her that much, and she could play just like a normal kid. Now when she jumps on the trampoline, I don't have to wait for something to happen, so that's relieving. The Zellers are more aware of the dangers. It means they know the dangers of having a bleeding disorder than most parents. Claire is an emergency specialist, and Rob is a surgical assistant in orthopedics. But that doesn't spare them from the challenges of dealing with their own child's significant illness. It means being doctors hasn't actually reduced the pressure, so they have to deal with the same challenges. It's quite confronting. So when something is confronting, it means it's difficult or it's upsetting, it's difficult to deal with, Rob admitted. He described one of Lauren's early falls, which resulted in blood coming out of her both her ears, as quite scary, even for a trained doctor. Challenging the paradigm, Queensland Children's Hospital hematologist Sally Campbell said teaching parents to give blood products at home was a really steep learning curve at the start. So when we say it was a steep learning curve, it means it was a lot to learn in the beginning. It can be a very daunting thing. So when something is daunting, it means it's super difficult. So it can be a really daunting thing for families to take on, for families to start doing or understand, Dr. Campbell said. hematologist Dr. Sally Campbell, Hemophilia Treatment Center Director at the Queensland Children's Hospital. Our multidisciplinary team supports families through the learning process, helping them build the skills and confidence to manage treatment at home. If an access doesn't go to plan, support is always available. Dr. Campbell said a key part of her job was to prevent her patients' bleeding disorders from interfering with their lives as much as possible. So when something interfere with your lives, it means it brings some challenges, it causes some problems. So they were trying to stop that, and they were trying to prevent that from happening. Historically, bleeding disorder centers typically told children and young adults not to play contact sports, but I think as our treatment get better, that paradigm is being challenged. So paradigm means like a model, a pattern, or way of thinking. So there used to be this paradigm that children who have bleeding disorders, they're not allowed to play, they're not allowed to live like a normal kid. But because of the treatments and because of the breakthrough that they have made in medicine, it's actually being challenged. So they're actually thinking of ways that that person with that disorder could live like a normal person. It used to be, no, you can't do that, but now we're saying, how can we do this safely together? Specialists aim, it means they have a goal to prevent breathing disorders from interfering in the lives of patients, such as Lauren. I really encourage the families to tell me what's important to them on a family level. I think there's a lot of inadvertent harm that you can do by restricting things too much. Restricting means limiting, and inadvertent harm means accidental. It means a harm that you do not intend to cause, but unfortunately it happens. Dr. Campbell said pharmaceutical companies were working on new drugs that would allow patients with von Willebrand's disease to inject them into the fatty tissue, like the way people with diabetes deliver insulin, rather than relying on a Port A catheter. She said although von Willebrand's disease happened in about 1 in 1,000 people, the prevalence means how common something is, how common it is for something to happen. The prevalence of the type 2B form Lauren had been diagnosed with was estimated at 1 in a million. So it's saying that the condition, the disorder that Lauren had happened actually 1 in a million. The prevalence was 1 in a million. We could say prevalence or frequency. Although she's only 3, Lauren is slowly getting used to having to have regular blood products delivered at home. I am brave, she said recently, as her dad administered a dose, as her dad injected or gave her a dose. Moving forward, the Zellers are grateful to more than 600,000 Australian blood and plasma donors for giving Lauren and other children like her the chance to live their best lives. It means Lauren can concentrate on being her confident and chatty self rather than worrying about her bleeding disorder. Lauren is getting used to having regular blood products delivered. Her laugh and smile is certainly infectious. So when we say her laugh and smile is infectious, it means it makes other people laugh and smile. And probably the best thing about her proud dad said when asked what made her 1 in a million. She is full of beans and absolutely developing a whole lot of sass. So when we say she's developing a whole lot of sass, it means she's becoming more confident, cheeky, and full of attitude. This week is National Blood Donor Week. To book a donation, call 131495, visit lifeblood.com.au or download the Lifeblood app. And that is it. That is the end of this article. I try to explain the some of the vocabulary or phrases that you might not understand. So I hope that this video has been helpful for you. And if you have any questions, please ask me in the comments. Have a great time.